Good evening, class. This is my flashcard presentation on peptic ulcer disease. Peptic ulcer disease is a disease of the upper gastrointestinal lining. It occurs when the mucosal lining of the epithelium of the stomach and the duodenum, which is the upper part of the small intestine, is damaged by the infection of the bacteria called Helicobacter pylori or H. pylori, or the use of non-steroidal anti-inflammatory drugs, that's NSAIDs, such as aspirin. Pathophysiology. H. pylori irritates the mucosa of the epithelium, which is supposed to protect the epithelium from gastric acid. This results in an inflammatory response, which leads to the alteration of the epithelium that can extend to the submucosal layers, to the serosal layers. The damage to the mucosal layer exposes the epithelium to the effects of gastric acid. The bacterium is able to survive this gastric environment because it produces an enzyme, that's an urease, that is able to convert urea to ammonia and carbon dioxide, thus forming a buffer against the gastric acid environment. NSAIDs, including aspirin, usually cause an inhibition in the production of prostaglandins that is needed to keep the integrity of the mucosal lining. A disruption of the integrity exposes the epithelium to gastric acid, which causes the production of an ulcer, which goes deeper and bigger with time, if not corrected. Risk factors to this disease are the presence of H. pylori infection, the use of NSAIDs, including low-dose aspirin, smoking, alcohol use. People who come from low economic status are susceptible to getting this disease. Stress, vitamin deficiency, anxiety, and then Zollinger-Ellison syndrome. Major signs and symptoms include, most of the time, patients are asymptomatic, and when they have symptoms, it's mostly upper abdominal pain. That is usually with eating for those who have gastric ulcer, and with those who have duodenal ulcer, it's okay, the pain is felt a couple of hours after eating. Other signs and symptoms include nausea, hematemesis, melanotic stools, maroon-colored stools, or bright red blood in the rectal area, depending on the severity of the bleeding. Diagnostic testing include endoscopy, specifically EGD, barium radiography, stool antigen testing to identify the bacteria, H. pylori, and also the use of ultrasonography. Thank you.